For the first time, people have died of AIDS in Britain after receiving transfusions of blood in this country. According to the Department of Health, the two victims received their transfusions several years ago. It's a grim reminder of how difficult it is to prevent the disease from spreading. One step which will help has been introduced today. From now on, all blood donated in Britain is to be screened for the AIDS virus. The fear of AIDS is deep-rooted. According to a recent Gallup poll, 65% of those questioned said it was a great concern. 27% said they had some concern, 5% said they weren't very concerned, but only 1% said they weren't concerned at all. There are already more than 200 cases of AIDS in Britain, but doctors believe that in addition, as many as 10,000 people may have the virus in their blood without showing any symptoms. About 1,000 of these will develop some form of AIDS in the next 5 to 8 years. But is the government spending enough on fighting the disease? This special report from Jane Corbin.
This woman's 11-year-old son is a haemophiliac. She was told a month ago he has the AIDS virus in his blood. This means he's a carrier and has a 1 in 10 chance of contracting AIDS. How did his parents react?
We were completely devastated at first. But we then realised that Paul had to go on living a normal life, and we had to adjust to it in the same way that we had to adjust to the news that he had haemophilia.
This 22-year-old professional man is a homosexual. He does not wish to be identified. He discovered last month that he has the AIDS virus, but he's afraid to reveal this to his family and employer. Many gay men who've admitted they have the virus have become social outcasts.
I feel that people with the virus are being treated inhumanely. I think that these people have to learn to come to terms with the fact that they are carriers of the virus and to carry the added burden of people treating them as they do. I think it is disgusting. I think it's about time that people had more compassion towards people who must be going through some terrible agonies.
Doctors believe AIDS could become the most serious epidemic in 50 years. In America, the disease is reaching alarming proportions. But here in Britain, the numbers are still small, though the fear of AIDS is widespread. Although we don't know how many people have been exposed to the virus, only 226 have developed the full AIDS syndrome in the UK, a fraction of global numbers. The World Health Organization say over 15,000 cases of AIDS have now been reported in 67 countries, and that does not include many Central African states, where AIDS is widespread but cases are just not reported. In 1982, there were 31 cases of AIDS in Britain. A year later, there were 45. By 1984, that had increased to 108. Now, 226 people are registered AIDS sufferers. Cases are doubling every 8 to 10 months, and by 1988, the experts estimate there will be at least 460, perhaps as many as 7,000. They've advised the health service to be ready to cope with at least 1,800 AIDS patients. The 226 people suffering from the full syndrome represent just 10% of a wider group who've had some form of exposure to the AIDS virus. Another estimated 600 people have AIDS-related complex, a less virulent form of the disease. And at least another 1,500 have had some exposure to the virus. They have AIDS antibodies in their blood, though they show no symptoms of the disease. Doctors believe that about 10% of them will develop some form of AIDS in 5 to 10 years. These figures represent the most conservative estimate. There could be as many as 10,000 people who've been exposed to AIDS.
Be kind enough to read the AIDS leaflet.
From today, blood donor centres will be handing out questionnaires and testing all blood to establish whether people have been exposed to AIDS in order to eliminate them from blood donor programmes. The test will also be available in special clinics and through some GPs. Doctors anticipate that thousands of people will prove to have been exposed to the virus. But the test, developed at London's Middlesex Hospital, won't identify everyone. Some people may show negative even though they have been exposed. AIDS antibodies are different from other antibodies. Having them in your blood doesn't mean that you're immune.
You may at any time in the rest of your life, we think possibly, develop disease which is related to that virus. Now, the incubation period we take as being 2 to 4 years, but equally well it could be 5 to 10 years. There may be people who are infected now who in 10 or 20 years' time will start suffering an illness because of their infection. We cannot say, we have no predictor, no blood test that we can do which will say what is going to be the outcome of an infection. We can identify the infected person, but we can't say what the outcome is.
When the AIDS virus, HTLV3, enters the bloodstream, it makes contact with a white blood cell called a T cell, which protects the body's immune system. The virus can penetrate the T cell because it fits the cell's own characteristics. Once inside, the virus sheds its own coat and its viral genes are absorbed into the T cell's own nucleus. From this point, the virus can remain dormant or it can become active. If the virus remains dormant, it will make no new viruses, but it may be contagious if infected cells are transferred to other people. If the virus is activated, and no one knows exactly why that happens, then the infected T cell, under the orders of the viral genes in its nucleus, makes new viruses by budding. These enter the bloodstream to infect more T cells. At this stage, the disease is transmissible. As more cells are invaded, the body's immune system is disabled and the full fatal syndrome may develop. It's thought the virus originated in the African green monkey. A monkey bite or insects could have spread the disease to humans. From Africa, AIDS travelled via the Caribbean to America and Europe. Scientists around the world are working on a vaccine, but they're unlikely to develop one in the next 5 years. There are several types of virus. It's proving difficult to isolate them all. So far, no drugs have been successful. Even if the virus can be destroyed, the body's immune system is fatally weakened. Drugs must be found to kill the AIDS virus and restore immunity. Scientists have found the AIDS virus in blood, semen, human milk, saliva and tears. Doctors are certain it's passed on through the first 3. However, sharing a glass, kissing or using a swimming pool are thought to be safe. Unclean toilet seats are not a risk. Neither is being in close proximity to an AIDS victim if he coughs or sneezes. Sexual intercourse is the #1 method of transmission. Homosexuals are most at risk, 70% of cases. Anal intercourse frequently means that tissue is ruptured, allowing semen into the bloodstream. But doctors are now finding that heterosexuals can get AIDS. It's mostly women who are at risk from infected men. But men have contracted AIDS from female prostitutes. These women may be infected because they're in another group at risk, intravenous drug users. People who share needles are vulnerable. When a victim passes a needle to another addict who uses it immediately, infected blood can enter his vein. Some prostitutes are drug addicts and can pass AIDS on to the heterosexual community via their clients. The third category at risk are people who receive blood transfusions. Infected donor blood can give the recipient AIDS. And haemophiliacs who receive contaminated blood products have contracted AIDS. In this country, 30 have the disease, 3 have died, and thousands have the antibodies. And lastly, babies can be infected in the womb via the mother's blood and later through her milk if she has AIDS. So far, only a few children have caught the disease from adults, but doctors fear the numbers will increase. Haemophiliacs are proportionately the worst affected group. Newcastle has one of Britain's largest haemophiliac centres. 76% of their 143 patients have the AIDS virus. 3 wives are also infected. Haemophiliacs need factor VIII, a clotting agent made from concentrates of blood. Because this country wasn't and still isn't self-sufficient in blood products, factor VIII was imported from America. It was contaminated with AIDS, and as a result, more than 4,000 British haemophiliacs today have the virus. Factor VIII is now heat-treated to kill AIDS, but the damage has been done.
I feel terrible as one of the men who had to prescribe that treatment, of course unknowingly that this virus was contaminating it. I think if government had really put its money where its mouth was many years ago and really given the blood transfusion service of this country what it needed and what it wanted, then many of our patients would be free of the risk of AIDS. And of course they now are, the ones who haven't come into contact, particularly with the American products, because the products are heat treated. But before that they would have only had British products, and all the evidence is that those were predominantly safe.
Within the family, I am talking to a few people, but obviously I feel you have to be very careful who you speak to and just what you say, because you can't gauge their reaction.
Yes.
Haemophiliac children and their parents say they've become social outcasts because of the general hysteria surrounding AIDS.
Our children are no threat to other children. Haemophiliacs, because they are a high-risk group, have in the main been tested for this virus. There are thousands of people walking the street who haven't been tested but who are carrying the virus. Yet haemophiliacs have been singled out to be discriminated against.
How do you feel about that?
I feel very bitter about it.
But it's not only haemophiliacs who are suffering. Homosexuals feel they're being discriminated against too. A benefit night at a London nightclub. The funds raised are going to the Terence Higgins Trust, the umbrella charity for AIDS in this country. Most of the people here tonight are gay. The majority of AIDS victims and those who have the virus are homosexuals. Once testing begins, even more will discover they've been exposed to the virus. Doctors agree that by and large the homosexual community has shown a willingness and responsibility to educate its own members in ways to prevent the disease spreading. Yet so far there's been no government money for a nationwide education campaign directed at homosexuals. Last year the Health Ministry gave just £12,000 to the Terence Higgins Trust. Now it's been cut to £10,000.
We have a serious epidemic. It's not too late to try and limit the damage, but I think if the government had acted sooner, we'd never have got to the stage where we're at now. We have warned, other groups have warned, hospitals have warned. On the basis of the American experience, we are going to have a serious problem with AIDS. And that warnings have been going out now for 3 years at least. The problem's been apparent for 4 years. If only they'd listened sooner.
Homosexuals who have the virus must alter their sexual life to stop AIDS spreading. Promiscuity, a feature of the gay scene, is out, and so is actual intercourse.
Personally, I've taken the conscious decision to not carry on how I have done in the past. I think that the guilt would be too great if I carried on how I did. I think I couldn't live with myself. I owe it, not necessarily to myself, but to other people, that I do change my lifestyle.
Jonathan Grimshaw runs Body Positive, a self-help organisation for AIDS victims.
People do react in ways that are quite unpredictable.
Callers can speak confidentially to group members who themselves have the virus and be put in touch with other men in the same situation, so they don't feel so isolated.
The plague of the 80s is the fear of AIDS. AIDS is not going to be a plague, provided that people understand what AIDS is and what it isn't. It is not a highly infectious disease. It is very difficult to pass it on. And when we can dispel the irrational fears surrounding AIDS, then we will actually begin to stop the spread of the infection in a realistic way.
So far, AIDS has mainly been restricted to central and west London. Doctors and the homosexual community are concerned to stop it spreading. The experience of Brighton, now a centre for the gay community, shows what can be done. Sociologists agree that gays here tend to be older and more monogamous than in London. Many gay couples come here to retire. So far, Brighton has only had 5 AIDS patients and 1 death.
Good evening, Sussex AIDS Helpline. Can I help you?
But gays in Brighton are far from complacent about the situation. They're already planning for the future and have set up a nightly helpline to cover the East Sussex area.
You're diagnosed antibody positive.
One of the two men answering the telephone and giving advice has the virus himself. The helpline group have started a campaign with the local hospital to teach people how to prevent AIDS spreading and keep them in touch with the latest research.
No, but HPA-23 seems to be the interesting drug, and I mean, obviously the Americans were going to Paris for treatment.
The group receives no government funds. They're managing on private donations of less than £2,000. Yet they say their preventative work is vital, because the local hospital hasn't the resources to cope with more than 3 AIDS patients at a time. The situation is the same all over the country. Only London regions have received extra money. All other areas must tackle the disease with existing funds. Critics say Britain should have had a strategic plan to deal with AIDS years ago. They point to Amsterdam. This city has been nicknamed the gay capital of Europe. Up to 20% of the population is homosexual. Back in 1983, the Dutch saw how AIDS was spreading in America and decided to take immediate action in their own country. The government appointed Dr. Jan van Wijngaarden as National AIDS Coordinator. He oversees a joint policy involving blood banks, hospitals and the gay community. The first step was to make Holland self-sufficient in blood products. As a result, very few haemophiliacs are AIDS infected. Dr. van Wijngaarden's job is not confined to the office. He goes out into the city's gay bars and clubs to meet people, listen to their fears and advise them. He himself is gay. So far, the Dutch have spent £6 million on AIDS and plan to double that next year. They're trying to educate not only homosexuals, but also the general public to prevent the spread of fear and prejudice. But how successful have they been?
We don't know if we can prevent spreading the disease more effectively as other countries, because the effects will be shown much later, will be seen much later because of the long incubation period, etc. What we see now has happened already before '83, before we started. So perhaps in 1988 or 1990 we can see the effects in terms of beating the disease itself. But what we can see now, and that I think is a major distinction between Holland and other countries, is that we, in a way, are successful in limiting the social damage done by AIDS.
The AIDS test is available in special clinics, staffed by volunteer gay doctors. But the official policy is not to encourage people to take the test, because there's no cure yet for AIDS, and a positive result causes enormous mental stress. The public attitude towards AIDS and those who have the virus is more relaxed than in Britain. The Dutch have always been tolerant of homosexuals. Gays have established themselves as a powerful political force, especially here in Amsterdam. 3 local councillors and 3 national MPs have openly declared themselves homosexual and campaign for gay rights. The situation in Britain is very different. There, homosexuals have only achieved a limited measure of acceptance. And they fear that the AIDS epidemic is creating a strong anti-homosexual backlash. Many in Britain believe that while AIDS was labelled a gay plague, researchers' and doctors' warnings were ignored because there was little political will in Britain to tackle the problem. But the attitude is changing as heterosexuals are threatened too.
We know that the virus can be spread heterosexually, both male to female, and there is increasing evidence of female to male transmission. And it seems that, as with the homosexual community where it's been most prevalent up to now, the major factor is the number of people with whom a person is in sexual contact, either directly or indirectly through their partners. And I think that although we are not going to see necessarily the same rate of rise of disease among heterosexuals, because most have fewer sexual partners, there is the risk that we will see a substantial epidemic unless people are, in a way, much more prudent about their sexual activity.
But there's another problem too. When testing begins, hundreds of men and women will discover they're AIDS positive and need sympathetic counselling.
When people are in a state of shock, they take time to get used to the news, and that means that it's important to give them that time just to let the news sink in and to react to it.
St Mary's Hospital in West London is training 2 people from each health authority to counsel AIDS sufferers. But doctors are worried this isn't enough. There are bound to be difficult cases. Women who discover they're infected may have to face up to the fact they have a bisexual husband or one who visits prostitutes. Some British doctors agree with the Dutch that testing creates more problems than it solves.
In a sense, the advice that we need to give people in order to reduce the spread of this disease sexually is advice that we can give without testing. We can give it to the person who has not met the virus. We can give the same advice to the person who has met the virus, both in their own interest and in the public interest. And I'm not sure that we necessarily need the prop of a test of rather uncertain significance, which may in fact be counterproductive in terms of its psychological consequences.
But those who have been tested and proved AIDS positive must now live with a 1 in 10 chance of developing a fatal disease.
I feel that there is no cure, and the way people are being treated at the present moment in time, I've not really gained anything. I seem to just be living under this constant threat of what may be.
We just want to watch our son grow up normally. He's an intelligent child. We want to see him develop into a useful human being. We just want him to be normal.
That report from Jane Corbin. The Minister for Health, Barney Hayhoe, was invited to take part in that report, but he declined.